It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hi again, everyone. Candace Kruger along with Jim Knox back again with another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that help change people's lives.
That is exactly right, Candace, and we'll kick it off with our first best doctor. That's neurologist Dr. Brian Sorin.
The typical type of patients that we see here are people who suffer from a significant amount of headaches. Not necessarily all migraines, but headaches of every different type. And what we try to do is figure out the generator of where the headaches are coming from and try to treat them more from the source.
My severe headaches were interfering with my long distance running. I run marathons and half marathons, and I wasn't able to train for those races any longer.
Sometimes when there's a component of a spinal leak or even an increased intracranial pressure, it's very hard to pinpoint over a long amount of time exactly what it is that caused that problem. So in Catherine's case, we couldn't tell if there was a positional component or not because she just suffered from headaches 24 hours a day, 7 days a week.
Dr. Sorin really took a holistic approach to identifying what my headaches were and providing a comprehensive treatment plan. So initially, he was able to relieve a very severe headache that had lasted 4 or 5 days by performing trigger point injections, which helped immediately relieve the tension and the pain that I was experiencing.
There's so much data now that has to do with migraine and increased risk factor for stroke. So if you have a patient who has a long-standing history of migraine headaches, we definitely want to get an image of their brain.
He's kind of empowered me to help manage the headaches on my own, and then I know that I can always go to him if I'm having an emergency situation and there's a headache that I can't knock out with the oral medication that he's given me to help treat it.
Based on her clinical symptoms, we devised that she had a low-pressure headache. And so what we did was we performed something called an empiric blood patch. And so what that means is that we will take sterile blood from her hand and knock her out, and instead of doing an epidural steroid injection, we'll actually use her own blood to form a clot over the area where the leak is coming from.
After I saw him, there were radical improvements in my quality of life. I went back to long distance running. I was able to complete 2 marathons under Dr. Sorin's care, plus many half marathons.
Vicki had sinus pressure with pain every day until she met Dr. Joshua James. To find out more about Vicki's story and other life-changing stories, log on to bestdocsnetwork.com.
I lost my teeth and had dentures at an early age in my early 30s, and I suffered from periodontal disease. They were ill-fitting, and I started suffering from burning mouth syndrome.
Susan is a remarkable case because she did lose her teeth beginning at a very early age. She put her dentures in with a lot of glue, went to work, it started to hurt so much, but of course she can't go without her teeth, she has to wear them. So she endures this pain through her workday, comes home, takes pain medicine, takes her teeth out, and goes to a dark room and goes to sleep.
We talked about the procedure, about removing some of the bone on the top and bottom on the gums so that I could get a proper fit.
We took out the remaining teeth, we placed implants in a bone, and we attached teeth to the implants.
It entails just 4 screws implanted on the top and the bottom. Then the teeth are made with the holes, and they're attached.
We can place the implants attached the teeth to it the same day, and now they go home and they're using teeth all in one day. That's what's remarkable. That is why implants have changed dentistry.
I would recommend the All-on-4 to anyone that is having any kind of gum disease, loss of teeth, that have ill-fitting dentures.
Her smile is even bigger than it ever was. She went home, she didn't have to take things in and out, she didn't have to use glue anymore, she got off all the pain medicine. She was a completely different person.
I enjoy going out more. I'm not worried about what people, think and being uncomfortable with the dentures. I feel more confident. My husband and I go and do things that before didn't want to do because I was more comfortable at home with my dentures out.
We got to change her teeth to be exactly like what she wanted. It's a great treatment for patients who want to go home with teeth or who can't tolerate dentures. It's an amazing thing that we can do with dental implants nowadays.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
Tennis elbow is a very common condition. The real medical term for it is lateral epicondylitis, which is a fancy name for pain on the outside of your elbow. But tennis elbow is a form of tendinitis, usually from repetitive use. What's peculiar is that 95% of the cases usually have nothing to do with tennis or any other racket sports. It's just everyday people doing repetitive things and they get the tendinitis in their elbow. Tennis elbow can present as both a sharp pain and a chronic pain. It usually gets very sharp when they try to lift something heavy. And they'll feel that sharp pain in the elbow, which can radiate into the forearm as well. But once you get it, it can sometimes be very difficult to treat. It usually lasts for months. We try to treat it conservatively initially. We do that with special elbow straps, and a lot of times you'll see people running around with these straps around their forearms. Some are just soft straps you wrap around your forearm. Some have plastic pieces and rubber pads in them. Some have little air pockets in them. All of them serve to put a little compression on the muscle and take a little bit of tension off the tendon to try and give it a chance to heal. We also try to treat it with steroid injections and anti-inflammatories, and sometimes with therapy and special stretching exercises. And we'll try to do that for several months. And most of the time that works. Every once in a while it doesn't work, and then we have to talk about the surgery to fix it. Now in the case of tennis elbow, the problem is that sometimes you get a lot of little micro tears in the tendon that just don't heal. And in order to address that surgically, we make a small incision in the elbow and we release the tendon, clean out the inflammatory tissue, and then anchor the tendon back down to the bone so that it heals as a nice solid anchor for the muscles that it's attached to. And then once you get a nice solid anchor, the pain and inflammation go away and you achieve pain freedom. After surgery, the patients are in a splint for 1 to 2 weeks, and then we start some gentle range of motion therapy. We don't really let them do any heavy lifting until 6 to 8 weeks after surgery. But once they get through the rehabilitation process, they're able to return to normal activity with significant improvement in their symptoms.
Depression is a very common and a very bad disease. It's different than sadness. Sadness is what happens when you go through bad times in life, and it just tends to come and go in all of our lives. Depression is an abnormality of the chemicals in the brain that brings on a lot of bad symptoms and often needs treatment with medications. The two main questions you should ask yourself to decide if you're depressed are these. Number one, have I felt hopeless and sad for most of the time in the past 2 or 3 months? And number two, have I lost my interest in those things that I usually get a charge out of doing? For example, ball games with the kids, movies, certain meals, certain things on TV. If you've lost your joy in life, that's a sign of depression, and it needs to be treated. What can you do about depression if you have it? Well, you can do a lot. You can take medication. There's a lot of medications that work, most with few side effects. Exercise helps, getting adequate sleep, and counseling also helps. So there's a lot of ways to go from sad to glad.
They were trying to get my veins, if I'm dehydrated and if I was colder, that my veins just don't want to pop up. And so they would put the compresses on, put me into warm blankets, and sometimes it'd be, 30, 45 minutes to an hour, so I would be that much more anxious to see if that was going to work before, they were able to, actually get an IV.
When you're not able to get their vein or, stick them the first time, they don't quite understand why that's the case. There are certain things that do prevent us from being able to thread our catheter through their vein. Here at SDC, we have just received a product that is accessible to our PAMA physicians called the Vein Viewer. It's an amazing product.
Often the patient's number one anxiety coming into a surgical procedure is the starting of an IV. As an anesthesiologist, my role is to facilitate the perioperative process and make it as efficient as possible. And having a device like the Vein Viewer is helpful for patients who have veins that are difficult to find.
We can use it on all of the patients to be able to visualize a live view of a patient's vein.
And using this tool, it allows us to get the IV started potentially a lot faster than if we don't have it. And that ends up speeding up the whole perioperative process.
We are the first facility in the entire country to have this product. We're very, very happy that we have it. It makes my life as a nurse way easier being a pre-op nurse and starting IVs every day and drawing blood on patients.
As a PAMA physician, I have the confidence in knowing that we have the best equipment possible to start IVs even on the most difficult patients. It makes me feel more confident going into the operating room that we're going to have a good IV.
You know immediately, okay, this is the right one, or no, this is not the right one. And so it really prevents multiple sticks, especially for patients who truly do not have great veins.
I know that I can come in and be relaxed and not be anxious, and first stick they're going to get me. It's a great piece of equipment.
Catherine suffered from migraine headaches, which kept her from running. But now she's back running again, thanks to Dr. Brian Sorin. To find out more about Catherine's story and other life-changing stories, log on to bestdocsnetwork.com.
Neck pain due to facet arthritis is a common disease. Typically, patients have dull, aching pain in their neck. It's usually on both sides of the neck. The pain can go up towards the back part of their head or can go down their shoulders. It's usually worse with movements or activities, and it's better with rest.
I was having lots of pain, experiencing lots of pain in my right shoulder, my neck, and my shoulder blade. I played the keyboard for my church, and it was causing me problems to be able to last doing that, and to do housework and to function.
Miss Allen asked me to help her with her neck pain. She had it for a long time. She tried stretching exercises, she tried physical therapy, she tried different medications to help with her pain. Nothing made a gigantic difference. She had an MRI of her cervical spine of her neck, and it showed that she had significant arthritis and degeneration at several levels in her neck.
When I came in, we tried some medication first, and the pain did not get any better. It got worse instead. When
I saw her in the office, she had typical presentation of neck pain due to facet disease. At the time, we figured out which joints in her neck are the painful ones, and we did an outpatient procedure called facet joint steroid injections on her, where we injected some steroids and local anesthetic into the affected joints in her neck, and she did well.
Instead of doing any kind of surgery, I wanted to go this route first and study Dr. Farhat. So we did this first. It's been working, and there's no stiffness, no anything. So I've got the pain freedom.
It's been years since she complained to me about her neck. At the time, she quoted her improvement at more than 80–90%, and she's been fine since.
I'm very grateful because he has made it possible for me to have the strength that I have and to be able to go and do the things that I can do now that I couldn't do before. And it's made my life an extension of the things that I couldn't do, and I am very thankful. He has made it possible for me to have the pain freedom that I have.
For more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com.
And right now, Candace, you know where we're heading?
I do.
It is our next best doctor. That's Dr. Glenn Ihde, who helped one individual suffering from severe gastric reflux disease.
My reflux was getting progressively worse to the point to where I was getting reflux from drinking a glass of water. And I'd gone to a gastro guy before, and he had told me, oh no, that's at least 5 to 10 years down the road. And then the next week I saw Dr. Ihde's piece on the news, and I gave him a call and said, hey, let's do something about this.
When patients come in and they have a variety of symptoms, some of which may be reflux and some of which may be other disorders, there are a lot of different tests that we can do. Upper endoscopy, pH study, manometry, a new study called impedance, upper GI study, which is an X-ray study, and also even looking at the gallbladder to see whether that's working. We have all those different tools to help us tell, is this reflux, is it something else, or are there two things going on? And to be able to get the right evaluation is very important, because if you don't have the right diagnosis, obviously the treatment's not going to work.
We did the endoscopy and took a look, and he said, yeah, you're a candidate for it. He explained to me that I had GERD, which is Gastric Esophageal Reflux Disease. And the procedure would be called a TIF procedure, transoral incisionless fundoplication.
When patients come into the office, we will sit down and discuss their symptoms. And we'll evaluate both their symptoms, we'll suggest a workup, then we'll decide whether they're a candidate for the surgery or whether they should have further evaluations to rule out some of the other conditions that can contribute to reflux.
I remember the first appointment prior to having the procedure, he had a dry board, and he drew his drawings and explained what was going to happen during the procedure, what was going on in my body. Dr. Ihde explains everything. A, B, C, all the way down to the Z. He explains it all, and he's very methodic, and he's open to any questions you want. He gets the job done. He's great, got a great bedside manner. I was able to enjoy life again.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Woke up one day about 13 years ago and couldn't stand up straight. And after seeking medical attention, sort of a variety of ways, one of the doctors I saw suggested I come see Dr. Shaw.
When we examine scars, I simply take something such as a PDA stylus that is very blunt, allow them or stimulate a non-scarred area remote from the area with the scar, so they know how this particular stylus feels with the amount of pressure I'm generating. When I touch the scars, quite commonly they are numb. They don't feel them at all until I hit an area of nerve entrapment. And those areas we mark with a skin marking pencil, and those are the areas that we inject deeper than the skin, and then we also inject the entire length of the scar.
As you move away from your surgeries in time, you find that there's sort of a new sort of pain. After you heal from the surgical pain and you get back into your daily life, you find that there's some new kinds of quirky little aches and pains and bristly things going on, and it can be scary. At first you can think, oh, my problem has returned.
Relative to her scar pain, really did achieve pain freedom. She has other problems that are still generating pain from her spine, but even that's much improved, not from the other therapies that we've done, but just from the scar injections.
It's comforting to have Dr. Shaw on my side, to know that it's his goal as well as mine to bring me pain freedom, and we work at that together, and I think we're doing a good job.
The Best Docs Network is brought to you by Modern Luxury Magazine, the premier magazine in the Dallas-Fort Worth area.
In this week's Best Docs Network special report, we take an up-close look at the LifeWorks Group. They help individuals with their mental health.
Before I came in, my life was really kind of in shambles. I didn't know where I was going. I was hurt. I was in a lot of pain. Really numb. This was a last-ditch effort coming here to LifeWorks. I had been referred to Melanie Wells.
I had been working in a variety of different practices for years, and I'd worked alone. I'd worked alone in a group. I was really frustrated by the lack of collaborative input. One day I was driving along Lover's Lane and I saw some space, and I thought I just had this vision that I wanted to have a collaborative team to work on cases together. Collaboration for us involves complementary specialties. There are more than 20 people on staff, and we try to thin slice our specialties so that we're not competing with one another, we're working together as a team.
My first impression of LifeWorks was this is very different than the other therapist office that I had tried to go to. Not so clinical, not just very relaxed, very easy. The people were very easy to talk to. It made you feel very comfortable and welcomed.
I try to look at a case from every possible direction, and as the clinical director, I'm going around the room making sure that I hear from anybody involved in an area of that case that might have something to offer. I want to know what everybody else thinks about my cases. Having 20 people in the room that have 20 different points of view is extremely helpful to the clients and to all the therapists involved.
One thing I really like about coming here is that I kind of get more than one therapist at a time. They take the time and work together, may discuss my issues. It completely feels like I'm going to a friend that knows exactly what's going on to me. So easy to talk to.
We believe that therapy starts with the phone call. So when a client calls in, we want them to feel welcome, and we want to be able to give them exactly what they need. Part of my vision for LifeWorks is to train therapists well, but also I want to be able to offer services to a wide range of individuals. I don't think money should ever be the reason not to come to therapy.
I don't even know how I would thank Melanie for what she has done for me. Words are not enough. It is invaluable what she has done. I love her to death. She's fun and just a really sincere person.
Jacob's quality of life was affected due to gastric reflux disease until he met Dr. Glenn Ihde. To find out more about Jacob's story and other life-changing stories, log on to bestdocsnetwork.com.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Vaginal rejuvenation is a procedure we do for women who come to me and they say, I just don't feel like I was when I was younger. It's just not the same after I had that baby. Well, what happens during childbirth, particularly a vaginal childbirth? The vagina gets stretched, the muscles loosen up, the vaginal walls stretch. And the result of that is that women feel loose. There's vaginal looseness, so they don't have those sexual pleasures like they had before they had the baby. We need to recreate those and bring them back to the state that they were before she had babies. The process is done here in the office. It is done while the patient is awake. We use sedation, mild sedation, and a local anesthetic. We tighten the muscles back together again. We recreate the vaginal condition such that it is tighter with intercourse and it feels better. The frictional forces are able to be created so that the patient gets better sexual pleasure. After vaginal rejuvenation surgery, patients are able to go back to work within 1 or 2 weeks. They're pretty sore down there, but we give them a prescription for special suppositories will help to reduce the spasms that they have and some of the soreness that they have. After a vaginal rejuvenation, we've had a lot of people come back and they say it's great, intercourse is wonderful, they are now feeling. Most women, right after the procedure, a few days after, can go back to work. Some people can go back to driving within a week or 2. But it's a rapid recovery. It's a procedure that is very low downtime and has great results. If the patient comes in talking about my labia are too long, they're extending below my labia majora, when I stand up I see tissue falling down in between my legs, I don't like this, it's uncomfortable with intercourse, and we can treat that with a labiaplasty. A lot of women, they have some poor self-esteem because of the way they look down there. By doing a labiaplasty, it helps boost up their self-esteem. They feel better about themselves because they look better down there too. We have options for people to help them to look better, to feel better about themselves, to help them to improve their sexual life, to improve their quality of life.
Cervical dysplasia is precancerous cells of the cervix. Cervical cells they're either squamous cells or they're glandular cells, and you treat them slightly differently depending on whether you have glandular dysplasia or squamous dysplasia. I always like to try to explain it to my patients on a scale. On this end, you could have a negative pap smear, and on this end, you could have cancer.
Well, before I got diagnosed, I was actually going to another facility, and my pap had came back bad, and they had referred me to Dr. Allen.
When you have atypical cells, nowadays we do HPV typing, so we know whether there's HPV present or HPV absent. And HPV is the cause of cervical cancer.
We did a biopsy in the doctor's office beforehand to test the cells, and the cells came back bad. And they said that they showed that the cervical dysplasia on the cells. And so then that's when they would go back in, when they went in and did the first procedure.
The problem is that when you get a patient that has low-grade dysplasia, a certain percentage of those patients are going to progress and a certain to worse, and a certain percentage is going to go away. And you think, well, how can it go away? You have a lot of cell turnover in the cervix, so you're constantly making new cells, you're constantly shedding cells.
We had the first pap done, came back abnormal. Then he went in and did the first LEAP procedure on me. 3 months later, come back, pap comes back bad again. You know, and of course that's my fear that something's, you know, what's happening, what's going to happen to my body, how are we going to fix this?
There's 2 take-home messages. 1, come in for your follow-up if you need to follow up, don't ignore it. And 2 is it is treatable. We should always catch it long before it becomes cervical cancer.
Well, I was very excited after I came back from my second procedure and found out that I was 4 weeks pregnant. I was very excited, just like any young mother, any young person. I was finally going to be a mom, and it was a very exciting time in our lives because I knew that all my problems were gone. And Dr. Allen had said, typically after the procedure and after you have a baby, you won't have any more problems.
Well, that'll do it, Jim. That'll wrap up another edition of the Best Docs Network, featuring some of the best physicians in the Dallas-Fort Worth area that have helped change people's lives. For more information on any of the fine doctors that you've seen on today's show, or to find a doctor that best fits your needs, head to our website at bestdocsnetwork.com.
That is the place to go. Also, if you have a question or comment for us, or a doctor that may have changed your life, we want to hear from you. Send us an email, info@bestdocsnetwork.com. That's info@bestdocsnetwork.com. So long, everyone. We'll see you next week.